Welcome to Mansik Shakti Foundation, and we are talking about the course for mind sciences and dealing with challenges of student life. And in that, we are discussing about awareness regarding mental health issues. We saw that what are the consequences of unawareness and how it affects individuals. So, what the issue arises, what are the causes of unawareness? What happens? Why people remain unaware? And the first and the foremost is about stigma. There is prevalent stigma surrounding mental health in Indian society, which leads to discrimination and marginalization of individuals with mental health conditions. Stigmatizing attitude contributes to reluctance of people to seek help or discuss mental health openly, even in families or amongst friends. You hardly come to know why somebody has disappeared for 3 months. You will be told that my sister-in-law went to her parents' place after the child was born. But the fact might be different. It might be postpartum psychosis, postpartum depression, for which the young bride was sent back. Whether she was given treatment or not given, we don't know. Often treatment is not given and they wait for automatic remission. That doesn't happen. So isolation, discrimination, prejudice, stigma are the first and the foremost causes of unawareness, why people do not like to discuss. But let me differentiate unawareness. When we say awareness, the responsibility and the onus is on self. If you say that I am not informed, then you can say that your exposure was poor, people were not talking about, so you did not have information. But as far as awareness is concerned, it puts a sense of responsibility on every individual to seek information, capture the issues, and care about himself or herself. The second important aspect is cultural belief and misconception. The cultural belief and misconception about mental health often perpetuates negative attitude and hinders awareness efforts. Traditional belief may attribute mental health issues to supernatural causes or view seeking help from mental health professionals as a taboo. People just don't want to talk about it because they feel it might be caused by supernatural, devil, and those unscientific propositions which is existing in the community. Or people might be afraid. They know, they have the sense that it is likely to run in the family. So they don't want their family to be shamed and named that, well, that is a family wherein someone became mentally ill, whether it is because of epilepsy and psychosis or schizophrenia or chronic alcoholism or OCD, it doesn't matter. It just doesn't matter. They differentiate between no mental illness and mental illness. Society is not that black and white. There are situations where you have a mental health which is good enough and you may develop depression for a brief period of time. You are treated and you are back into mainstream of life. Everything is good. But such positions are not considered by people in society. And this is called unawareness. That you are not aware about prevailing situation in contemporary time in the society that you are living. Lack of education and awareness, limited understanding and awareness of mental health issues among general population, including inadequate education about mental health in schools and communities, contribute to overall unawareness. Many people may not recognize the signs and symptoms of mental health disorders or understand the importance of seeking help. Limited access to mental health services is also one of them, because there is no service, there is no hospital, there are no psychiatrists, there are no mental health specialists. So even physicians don't know. They cannot treat patients. When the patients are not treated, everybody around, as an example of mental health, is untreated illness, and that gives negative attitude. The availability and accessibility of mental health service in India remains inadequate, particularly in rural areas. Factors such as shortage of mental health professionals, underfunded services, stigma associated with seeking help deters individuals from accessing timely and appropriate care. Then comes the socio-economic factors. The socio-economic disparity, including poverty, unemployment, and lack of social support, exacerbate mental health issues and contribute to the unawareness. Economic constraints may prevent individuals from seeking mental health services and accessing necessary resources for treatment and support. A good example of this is a housewife. If you see any condition, say chronic pain, backache, depression, anxiety, remains untreated for a number of years. You know why? Because she is a lesser priority candidate in the family. So socio-economic condition, gender positioning, gender discrimination, economic reasons are also very important causes of having no information or unawareness or stigma. Addressing the cause of unawareness towards mental health in India requires a multifaceted approach that includes promoting education and awareness, reducing stigma, improving access to mental health services, and addressing systems of inequalities. Efforts to destigmatize mental health, increase public awareness, and integrate mental health education into various sectors of society are essential for fostering a more informed and supportive environment for mental health in India. Gender norms and rules are also very important. They're quite prevalent in Indian society and may impact mental health awareness and help seeking behavior, as I said just now. Cultural expectations regarding masculinity and femininity can influence how individuals perceive and express mental health concerns, with men often facing barriers to seeking help due to notion of Scotism and self-reliance. Media portrayal and public discourse is very important, because today's world is all media. Social media, formal media, negative portrayal of mental health in media, including sensationalized and stereotyping, perpetuate misconception. Every time you see a film, all you will see is a shock machine and a mental health patient. The two are put equivalent. Such negative portrayal, portraying about suicide attempt, chronic mental disorder, Alzheimer, dementia, forgetfulness, odd behaviors, OCD, drug-seeking behavior, they all have been captured in films. Lack of accurate and sensitive presentation in public discourse further hampers efforts to raise awareness and promote understanding. Here I must place on record that there are media portrayal, there are movies which are par excellent, like The Beautiful Mind for schizophrenia. One must watch and see how realistically the films have been made, some on real stories, some on stories of self-narration, but it is, I'm sure it's catching up and things might change. So these are some of the important causes of why people remain unaware, why stigma is prevalent, how prejudice operates, And all put together, these are non-medical factors which creep into life of your children and causes long-term consequences. Untreated illness leads to partial recovery only. Must remember that every serious illness has an important precursor, and that is minor symptoms. We miss that, we do not recognize those, and therefore the illnesses become very chronic, particularly relevant for people who are in adolescence and in universities. They must be very, very careful and watch out and take control of responsibility of their own awareness. Continue to watch.